Well, infertility, as you all know, is defined as inability to conceive after 1 year of uninterrupted intercourse. The causes are either male or female or both. Previously, male causes of infertility were very much underrated. But over the past 1 decade, we have seen there has been an enormous increase in the percentage of causes of male infertility. 30 to 50% of the cases of infertility are accounted due to male factors. The male factor infertility can be of two types. Either they may be due to congenital defects, that is defects that are there from the birth itself, or acquired. We will first start with the congenital defects. Congenital defects, as you all know, spermatozoa are formed in the testes, and then they are carried by a duct which is called vas deferens to the penis, and then the semen comes out through the penis as an ejaculate. If there is an abnormal position of the testes from birth, that means the testis, which originally is in the abdomen and it descends down to the scrotum, if it gets held up or stuck in the path, it is called an undescended testis. And if it is not corrected at a very early stage, the testis tends to grow smaller or it does not grow, and spermatozoa production is affected. So this cause, one of the primary causes, is undescended testes. Number two, there may be a congenital absence of the duct which carries the semen to the penis. That is called the vas deferens. That is a congenital absence of the vas deferens which may be there. There may be some genetic or chromosomal abnormalities of the person himself which leads to defective formation of spermatozoa. These are mainly the congenital defects. Acquired defects, that means which are acquired by the person after birth, in puberty, in adolescence, and later on in life. The most deterrent factor nowadays is lifestyle. Lifestyle disorders. We all are accustomed to live with stress, but it has been seen that stress causes an immense effect on the quality, on the volume of semen and spermatozoa. What happens? Due to stress, people tend to smoke more, drink more, maybe get addicted to drugs, and all of these cause a great difference in the morphology, in the motility, and the count of spermatozoa in semen. So these are lifestyle problems which we need to discuss about, which we need to encounter. Next comes, there is an infection, mainly in males in childhood. They have mumps infection. The testes gets inflamed. It's called orchitis. And orchitis, if it occurs, may result in a permanent damage to the testes, leading to decreased production of spermatozoa. Third is other infections. Any viral infection per se may cause a decrease in the count, in the quality of spermatozoa in males. Other defects that may occur is there may be trauma, there may be a condition which you are well acquainted with called hydrocele, and there is another disease which is called varicocele, where the veins around the testes are dilated, leading to a temperature change in the testes, in the milieu of the scrotum, which leads to decreased production of sperm and defective production of sperms. So these are certain acquired disorders, and over the years, as we see the quality of spermatozoa all over the world, it's not peculiar to India, it's all over the world, it is deteriorating, and the count, the quality, the morphology, the motility is coming down. So when a patient comes to a doctor, to an infertility specialist in the clinic, first we need to take a detailed history about his childhood, whether he had mumps in childhood, whether there was any operation done on the patient due to undescended testes. Next we go to our lifestyle disorders, the stress that he has to undergo, the medications that he has been taking, after this comes the physical examination, where you see the size of the testes, whether the testes is of normal size or the size of the testes has decreased. You see the scrotum. You can do a maneuver called a Valsalva maneuver to see whether there is a varicocele or not. You can rule out a hydrocele, and if required, we can always go in for a ultrasound of the scrotum to see the architectural morphology of the testes. Then comes the semen examination, which is so very important, and every year WHO comes up with a criteria of semen examination that's called a semen analysis. Ideally, a person should maintain an abstinence period of 3 to 5 days before doing a semen test. And a semen test, I repeat, should be done in a quality lab, because this is a report which has to be given by a very experienced, qualified personnel. The things that we monitor is, we see the total count, which should ideally be above 15 million per ml. We should see the morphology, ideally 4% or more should be normal. We see the motility, where we gauge both the progressive and the non-progressive motility, and the comprehensive total value should be over 40%. So these are the basics, and we also look for infection. So if any of the parameters are abnormal, the doctor takes care of the parameters and goes forward for the treatment. So this in a nutshell is what